My name is Sharon Gwynn. I'm the Deputy Commissioner of the Division of Epidemiology here at the New York City Health Department. Thank you all for joining us today for the 20th anniversary of 9/11 Town Hall as we commemorate the day that changed many of our lives forever. Today we plan to share some research findings and lessons learned from our World Trade Center Health Registry. Before we jump into the agenda, I would like to welcome our Commissioner of Health, Dr. Chokshi, who will share some opening remarks.
Good morning to everyone. I'm just truly honored to be part of this important event commemorating the 20th anniversary of 9/11 and paying tribute to you, to the more than 71,000 enrollees of the World Trade Center Health Registry. First, let me start by thanking all of today's presenters and also everyone who has made the registry such an inestimable model of public health practice and also of humanity since its inception in 2002. I'm so proud that the New York City Health Department quickly understood and acted on the need to track, assess, and support both the short and long-term health concerns and needs of those who are directly exposed to the 9/11 disaster. Although the World Trade Center Health Registry is the largest post-disaster registry in United States history and among the longest running, the magnitude of its lessons and impact are limitless and ongoing. We continue to learn extraordinary lessons about the large-scale physical and emotional consequences of that terrible day, about the individual stories, battles, and triumphs that lie underneath the science and statistics, and about how each of those individual experiences interweave with the fabric of families and society as a whole. I have little doubt that the registry's volunteer enrollees have contributed to a wholesale shift in how to treat and care for survivors of trauma in all its forms. As a result, the registry's enrollees have been critical in advancing trauma-informed care, a whole-person approach which takes into account a person's unique history and totality of trauma, be it terrorism, violence, racism, personal abuse or neglect, poverty, or, say, a pandemic. But while the registry will always continue to provide us invaluable insight into the many and varied health effects of disaster and trauma, its heart remains all of you, the enrollees. Since 2002 and throughout COVID, our enrollees and every individual most directly impacted by the tragedy of 9/11 have remained in our thoughts and in our work, prioritized not only because of what they can teach us, but because of the grit, fortitude, compassion, and dedication they have demonstrated without fail these many years and counting. Whether heroes from day one, like the first responders and others who placed themselves in harm's way to help others, or the bystanders who have become heroes and are helping others by virtue of their openness, participation, and selflessness, you have never been forgotten, and our gratitude and commitment to you have never waned. We promise to keep working alongside you no matter what develops. We promise to keep delivering information and care that promotes your health and well-being. And we promise to keep honoring you as people and priorities. We owe you that and so much more. I'm looking forward to the rest of today's roundtable, and I'm looking forward to many more years of mutual education, care, and growth. Thank you so much.
So today you'll hear more about some of these important findings that have come out of the registry work. And I wanted to just quickly introduce the panel now to you. So in addition to Dr. Chokshi, we have Dr. Mark Farfel, who is the Director and Principal Investigator for the World Trade Center Health Registry, Dr. Robert Brackbill, who is the Director of Research and Surveys at the Registry, Dr. Jim Cohen, who's the Medical Director, lead of the Medical Surveillance Team. And then finally, we have Jacqueline Osaro, who is a Manager of Public Affairs at the World Trade Center Health Registry, who's going to describe the registry background for us. us?
The registry was established in 2002 with federal government support and is based in the New York City Health Department. It's the largest post-disaster registry in U.S. history and one of the longest running in the world. In 2003, we began tracking the short and long-term health of more than 71,000 people who voluntarily enrolled and were directly exposed to the 9/11 disaster in New York City. Those are the people we call our enrollees. Since 2003, we have conducted 5 major health surveys enrollees over time, including the most recent one, which was in March of last year and just got concluded. We have also conducted shorter surveys that have focused on specific conditions, including autoimmune disease, COVID-19, as well as things such as disaster preparation after Hurricane Sandy. Our survey creation is collaborative. We work with a community, labor, and scientific advisors and collaborate with the World Trade Center Health Program, which is where enrollees and other people exposed to 9/11 get healthcare. We also work with other healthcare providers and researchers. We share our scientific findings with enrollees, the public, and other stakeholders on 9/11 related physical and mental health outcomes, gaps in care, quality of life, functional status, job loss, and early retirement. Our findings help inform healthcare policy for people exposed to 9/11, not just our enrollees, and also helps with future disaster preparedness and response. Our registry also serves as a platform for approved 9/11 related research by other researchers outside of the registry.
First, I want to add my heartfelt thanks to all of our enrollees for participating in our surveys and showing so much dedication to the registry over the years. And your help is really invaluable to learning about the health impacts of 9/11. We obviously couldn't do it without you. And we hope that you'll continue to participate in future registry surveys as we now enter the 3rd decade since 9/11. While our registry was not designed to provide clinical services, we do continue to collaborate with the World Trade Center Health Program, their doctors, their researchers, and we respond to enrollee healthcare needs and concerns because we see this as a core part of what we do. And we will continue to reach out to our enrollees to encourage and help them apply to care through the health program. We'll also continue to provide 9/11 related health materials, findings, and resources to our enrollees and the public through our website and our newsletters and through social media. So next, I want to mention who was eligible to enroll in the registry in 2003 and 2004. The registry was designed to include people who were likely to have been highly exposed to the 9/11 disaster in New York City. And these included people who lived, worked, or went to school in Lower Manhattan, passersby, and people in transit in Lower Manhattan on the morning of 9/11, as well as rescue recovery workers. Enrollment ended in 2004, and at that point, the registry had successfully enrolled more than 71,000 people. One of the strengths of the registry is that we have diverse groups of responders and civilian survivors, including WTC Tower survivors, responders who worked on the Staten Island landfill, and cleanup workers. We have enrollees from every state, which reflects in part the fact that responders came to New York City from across the country. And we also have enrollees from more than 15 other countries. And overall, we have nearly 1 in 5 of the estimated 400,000 people who are eligible to enroll in the registry. So far, the registry has more than 150 publications reporting on a range of physical and mental health outcomes and 9/11 consequences. And our papers are listed and summarized on our website. So what I'll do now is briefly mention some main findings and lessons learned. The 9/11 WTC disaster has had enduring and significant impacts on survivors' physical and mental health, health behaviors, quality of life, and functioning. And the most common 9/11 related conditions are post-traumatic stress disorder, PTSD, depression, asthma, gastroesophageal reflux disease, GERD for short, and upper respiratory conditions such as sinusitis. And these conditions often occur together. That's a hallmark of 9/11 conditions. And now I'll turn it over to Dr. Brackbill, who will speak about selected physical and mental health outcomes.
Good morning, everyone. I'm really pleased to have this opportunity to, provide some detail on, some of the research we've been doing. Respiratory conditions have been a prominent problem for a person exposed to environmental contaminants. We especially have responders who perform rescue recovery work and cleanup. We also have people who are caught in a dust debris cloud. And also, those who worked and lived in the area up to 15 years after 9/11, that we still find 15% of enrollees had reported asthma that was diagnosed after 9/11. Gastrointestinal reflux disease, or GERD, is a frequent heartburn or acid reflux. One of the most common conditions reported among persons exposed to the 9/11 disaster. 22% of adult enrollees reported being diagnosed with GERD 16 years after 9/11. This condition also co-occurs often with asthma and post-traumatic stress disorder. One of the interesting things about it is asthma and GERDs are related to each other, but it's PTSD that plays what we refer to as a mediating role, in connecting the asthma and the GERDs conditions. The registry has been tracking the symptoms of PTSD since 2003 and has found that although many people have resolved post-traumatic stress disorder over the years, there's still about an 8 to 10% of enrollees who report symptoms. One of the main factors, other than the intensity of exposure, has been the loss of job because of 9/11. Children of 9/11, who were younger than 18 in 9/11, are considered a priority group by the registry. 9/11 children experience the same 9/11 related health conditions adults do, including elevated occurrence of asthma, PTSD symptoms, and increased use of tobacco and substance use. We also found that the mental health of parents who've been exposed to 9/11 influences their children in negative ways, such as behavioral problems or difficulties in school functioning. Women pregnant with 9/11 who are also at a higher risk of adverse birth outcomes, including low birth weight, preterm deliveries. Now I will hand this over to Dr. Cohn, who will now talk about findings in post-traumatic growth and emerging health conditions. Thank you.
Some enrollees did experience more positive psychological growth after 9/11. This growth can take many forms, from understanding better people who have suffered similar kinds of events, recognizing new opportunities, seeing that maybe there are things in life that they want to pursue that they didn't think of before, having a greater appreciation for life in general, feeling that having lived through that terrible event, they can face the future with more confidence. Dr. Chokshi mentioned, as humanity, we're experiencing new challenges every day, from the consequences of climate change to the turmoil from the continuing COVID pandemic. The registry also is alert to emerging conditions associated with 9/11. For example, pulmonary fibrosis. We found that the World Trade Center dust exposure among rescue and recovery workers increases the risk of pulmonary fibrosis. This is a scarring condition of the lungs. Another condition, systemic autoimmune diseases, which includes conditions such as rheumatoid arthritis, lupus, and Sjogren's syndrome. Community members with post-traumatic stress disorder were 3 times more likely to have a systemic autoimmune disease. We did find that exposure to 9/11, building collapse, and the dust cloud was associated with hearing loss or hearing problems in both rescue and recovery workers and community members who were highly exposed. Next, we'll hear from Mark Farfel about a special feature of our registry called the Treatment Referral Program. Mark?
Some people with 9/11 related symptoms and unmet healthcare needs are not yet enrolled in the World Trade Center Health Program. And we've learned about some of the barriers to care, and they include people just not being aware of the World Trade Center Health Program, or people not realizing that their symptoms may be related or connected to their experiences at 9/11, or people thinking that others just deserve care more than they do because they perhaps might be suffering more. Others worry about the stigma that is associated with having a mental health condition, and yet others need some assistance with the health program application. So to address these needs, we've been operating for some years now a treatment referral program. We have staff who are trained to help enrollees address these barriers and apply to the health program. And so far, fortunately, thousands of our enrollees have responded to this type of personalized outreach and have made an application to the World Trade Center Health Program. And that makes the registry an important source of new applications, both from responders as well as non-responder civilian survivors, including Spanish and Chinese speakers and other groups who are underrepresented in the health program.
The Federal World Trade Center Health Program provides monitoring and treatment, including medications for physical and mental health conditions related to 9/11. Apply online at cdc.gov/health VCF.gov/WTC or call 888-982-4748 and we will mail you an application. The September 11th Victim Compensation Fund, VCF, provides compensation to individuals who were present at the World Trade Center or the surrounding New York City exposure zone, the Pentagon crash site, and the Shanksville, Pennsylvania crash site at some point between September 11, 2001 and May 30, 2002, and who have since been diagnosed with a 9/11 related illness. For more information, visit vcf.gov or call the VCF helpline at 1-855-885-1555.